Hope you got all see me. Hello. Hi guys, this is Tanvir. I'll be demonstrating the IV piggy bag skills on my assigned patient Mr. Tutu. For that reason, I've uh, divided my presentation into few parts. Like first of all, I'll gather my equipments, then I'll calculate the dose, then I'm going to prepare medication, then I'm going to administer the medication to my patient Mr. Tutu, and finally I'll document the whole procedure. So before that, I would like to show you my. I'm using my thing. I'm just down making it down so that you can see my all my equipments. After getting that, I'll start with my hand sanitizer. There's my gloves. First and foremost, this is Mr. Tutu's medication chart, MAR. X7 here, as you see, his orders and his medical history, and the document chart. My pen, Mr. Tutu's ID bracelet, one label, then the medication, here the medication gravel, my watch to adjust the time, angiocath, 5cc syringe, with blunt needle to put the medication, one alcohol swab, 50 ml normal saline solution, where I'm going to put the medication, and the secondary set with the hook, extension hook. I hope the light is fine because I'm doing when my kids are sleeping. So I just wanted to make sure you have got enough light what I doing, because for the COVID situation, we don't have any more resources. And also I would like to mention that I am using my code track for my priming. My primary set is already there with the rate already set 17 drops per minute. So now I'm going to show you how I'm going to what the Mr. Tutu's chart says. Mr. Tutu is feeling unwell, has not been eating well because he has nausea and vomiting, and that's why we are giving him gravel medication as per Dr. Smith's order. And also he is feeling nausea and vomiting for that reason. So he has some comorbidities like type 2 diabetes, osteoarthritis, and his vitals are within normal stated here in the medication chart. And we are going to administer dimenhydrinate 25 milligram in 50 ml normal saline IV and I'm going to calculate the rate for his nausea. So first step, we have to calculate. That's important because and I already did my first check with verifying Mr. Tutu's name, his treatment dose, route time. Now I'm checking the expiry date on the medication. It's dimenhydrinate gravel. Expiry date is 10th March 2023, so it's good. And the order says to give to administer 25 milligram in 50 ml normal saline mini bag in 20 minutes of time. So 50 milligram is equal to 1 milliliter. So 25 milligram of that will be half. So it will be 0.5 milliliter will be administered in his medication bag. Now I'm calculating the correct infusion rate. The infusion rate at 100 ml per hour for the medication gravel, 50 ml in 20 minute drop rate comes to be 25 drops per minute. So after rounding, I'm using the calculator, comes to be 6.25, hope you can see. So for rounding sake, we can adjust it at 6 drops per 15 seconds. When I'm going to show you how we are going to calculate later on. Then I'm going to assess his site. The cephal, I've chosen his left cephalic vein, and there is no site of any redness or injury or infection swallowing. So everything's fine. So after that, I'm going to prepare my medications. And for that reason, I'm going to, because this been very aseptic process, I'm just taking my hand sanitizer before that. And as there is no visible swelling on my hand, so swallowing on my hand, I'm taking my gloves on. If my hand was visibly soiled, then I would have taken a soap water sanitation, because very important sanitation, like hand hygiene is so important. Now my second check. After the hand hygiene, I have to check with the MAR, the gravel medication, 50 milligram per ml. It's written here. This is my second check. Now I'll be administering this dose into the piggy bank. For that reason, I'm going to open this alcohol swab because I want to make it septic. I'm going to open this 5 ml syringe. I'm going to hold it here. I'm going to scoop this blunt needle. I'm going to open it here. I'm going to hold it, and I'm going to open the alcohol swab with my thumb with the medication. And like I already mentioned, I'm taking this swab this way, and I'm going to gently on the tip of the center of the medication side, I'm going to just wipe it, and I'm going to put we have already calculated, and we have the dose is 0.5 ml, so half cc. So I'm going to take this out, and I'm taking 0.5 cc air, putting directly into that injection bottle, pressing, and I'm going to take exactly 0.5 ml of the medication Gravol as per the calculated doctor's order. I have to make sure that there is no air bubble. Okay. Yes, there is no air bubble now, as you can see here. Ideally, we should have 3 cc, but we don't have any 3 cc in the supply. So what we have got, so we are going to use it. So now I'm holding this on my right hand, and with my non-dominant hand, I'm taking the alcohol swab one more and swiping the medication port of this big bag, 50 ml containing 50 ml normal saline. I'm going to pour this into the medication port right here, all the way down slowly. And I'm like I said, I have already a sharp container. I'm going to put the sharp container on the needle, and I'm going to put it, and I'm keeping it here, and I'm just going to put the names and details of the patient on my label. Room number 300, drug dimenhydrinate, Gravol 50 ml, amount 25 milligram, 0.5 milliliter, added by my name, my initials, Tanvir Ahmed. Base solution is normal saline, and today's date, 4th November. Start rate, start time is 1600 hour, and the flow rate is 25 drops per minute. Now I'm going to put the sticker on the back. Yeah, and I'm going to gently agitate this normal saline so that it mixes evenly. And this is my third check also, because I make sure that drug is there, right dose, right amount, and right route. So I'm just holding on to that. Now, before that, now our preparation part is done. Now we are going to administer this IV piggy bag. Now I'm bringing all my medication chart, all my MAR, all this sheet, all this MAR paper, and secondary set. Here's my secondary set and alcohol swab, everything to the bedside of Mr. Now I'm going to introduce Mr. Hi, Mr. Tutu. This is Tanvir, your nurse today. I'll be administering the injection Gravol for your nausea vomiting. I'm just going to check your ID. Can you please tell me your date of birth? Yes, thank you. It matches with the ID. So that's my, and I'm also checking on his bed chart, his medication medication sheet. So it also, that's my fourth check. Now I'm going to hang my IV piggy bag on the pole with my coat stand. But for that reason, I'm going to put the extension hook first. Before I spike that, I have to put that normal saline down before for the gravity, because we want our medication to put out. So I'm just putting it down. Now, with all aseptic precaution, I'm just taking out the secondary extension set, checking it, everything fine. There's a cap, and here's my medication. So what I'm going to do now, I'm going to pull the cap or the blue tip, and I have to put this spike aseptically so that it doesn't touch and there's no chance of contamination. So I'm taking it out and putting all the way here. So it nicely fixes. And I'm like I mentioned, when I was check the tubings, I made sure the clamp, roller clamp is already in closed position. See, so no water will be, like no medication will be lost or wasted. So I'm going to put it up here. And as I mentioned, when I was checking the tube, make sure that the cap is there. So the port we are going to connect will be here. Hi, Mr. Tutu. Hope you are doing well. So after the spiking of the tube, secondary tube, and I've already uncapped. Now I have to cleansing the port, and before we connect, and opening clamp. Excuse me. So I'm taking the clamp out, and we have chosen to put the extension tube right here. After opening, we have to make sure alcohol swab. With alcohol swab, it's already cleaned, and I'm going to connect the tubing all the way. Now, I have to adjust the rate. Should be 6 drop per 15 seconds. Yeah. I'm using my watch just to make sure that drop is coming. Yeah. I want to show you the drop because although there's no one to help me here, because I hope you can see here, it's adjusted 6 drops per 15 seconds. Okay, my level and everything's fine. Okay, as per calculation, it's everything going on now. Hi, Mr. Tutu. I hope there is any pain. No, thank you so much. Now I'm going to document my records here, and I put my initial, as you see. Sorry, excuse me. Here, start date, today's date, Diamine Hydrinate, my initial, 25 milligram, 50 ml in normal saline 20 minutes, my initial, and ends date. And there's my name, signature, Syed Tanvir Ahmed, RN, and my initials. So, Mr. Tutu, I'm going to check you later on in 10-15 minutes, and I don't see any swelling or any bruising redness in the site. So, assuming that our secondary rate is already done, so once it's done, I'm going to close it. I have to remove the tubings. Remember, we are all using the aseptic techniques. We are not using or contaminating, touching anything. And we are going to discard in a biohazard bag. So I'm going to remove this port. And I'm going to put I'm going to swipe it before again with the alcohol swab. I'm going to put the cover. Okay, that goes there. And I'm removing the extension hook now because it's done. The job is done now. And we are going to adjust the flow rate back into 17 drops per minute for the prime line. Okay, following everything's done. Now I have to close the clamp and secondary side. And hi, Mr. Tutu, hope everything's fine. There's the call bell within your reach. If you have any problem, let us know. Thank you so much and have a wonderful day.